All right. What is your name and your profession?
My name is Monica Ford, and I'm a registered nurse.
Awesome.
My name is Julie Torsone, and I'm a pediatric nurse practitioner.
Have you had interactions with COVID-19 patients, and if so, how has it impacted your interactions with them?
What we started seeing was that children would test positive for it, but they were asymptomatic. So they would come in with appendicitis, and we would test everybody before surgery, and that was, or before any hospital admission. So it's just like a screening tool,
Yay.
but then they would end up being positive even though they had no symptoms.
Have you had interactions with influenza patients, and if so, how has that impacted your interactions with them?
Yeah, so we had a huge, super flu back in November, and most of those patients, actually, they were pretty sick because everybody's been wearing masks for so long that when they actually didn't wear masks and they got a virus, it hit them really hard. So didn't really change much with them. Flu is a respiratory virus, so we still had to wear masks and goggles. Didn't have to wear a gown or anything. So it was a whole lot less cumbersome as patients with COVID. But flu, just treat it like any other virus.
Questions. Have you had interactions with tuberculosis patients, and if so, how has it impacted your interactions?
Ironically, I think I only took care of one patient with TB one day 20 years ago or 25 years ago.
Yeah.
Like when I worked in the PICU at UNC as a nurse, we had one once. But most kids, it's unusual for a kid to have TB. And then my job now is with surgery, so it's even rarer that they would need. So there might be some admitted to the hospital, but they're not on my surgical service.
Yeah. I noticed that it was very rare, so I assumed, especially in kids.
Yeah, with kids, because they're vaccinated, right? They're a part of their routine vaccination. So we really, that's something I never see.
Yeah. And then lastly, the same question, but with MRSA. So how did that affect your interactions with patients?
So MRSA is a little different. MRSA is so common now. Everybody has pretty much, if you swabbed 99% of our noses, we're going to have it.
Yeah.
But open wound with MRSA is a lot different. I have had patients that have actually had necrotizing fasciitis from the wounds from MRSA that has actually infected them all the way down into their bones.
Across those 4 diseases, what are some of the common symptoms you've noticed amongst the patients?
I mean, the first 3 are primarily, respiratory illnesses. So those 3 have a good bit in common with the cough and fever. If you throw in the MRSA, I would say fever is a common symptom across all of them, and also just like irritability. And with kids, we'll see a lot of dehydration from poor oral intake, along with their fever.
Okay, cool. Well, that's all I have.
And being contagious, that's another common thing.
Oh, yeah.
All of them are very contagious, so that would be another big one.
Yeah. Okay. Well, thank you so much.